Now let's do some light and fluffy stuff. All right? Abnormal findings. Okay? Sensory loss. Okay? Paresthesia. Paresthesia is that there's something wrong with the feeling. Okay? Just abnormal. A good example of this is pins and needles. You could feel something, but something's weird about it. Okay? Paresthesia. We could also have anesthesia, where you have no sensation at all. I think you have an idea what that is by an anesthesiologist, right? You could also have hyperesthesia, where the sensation is much greater than what it should be. The only example I could really give you on this is more like you have a low tolerance for pain. Ow! What do you mean? I just touched you over there. I know, but it hurts so bad. That's hyperesthesia. Okay? Spinal cord injuries. Paraplegia is half the body's paralyzed. Now, don't get this confused. Paraplegia. Is that the upper half and lower half, or is that the right side and left side? You see the difference? When you say that half the body, what does that mean? Paraplegia means that the lower limbs are affected. So it's upper and lower. Okay? Quadriplegia is 4 limbs are paralyzed. Much higher. Okay? Flaccid, we talked about this, flaccid. It's you know, you can't move it, but it's flaccid, as opposed to spastic. You can't move it, but it's fixed. It's contracted. It's flexed, and it's hard to release that. So it's just showing you the difference between paraplegia and quadriplegia. Okay? You could never have, if you think about it, well, what do you call it where you can't move your arms, but your legs are fine? What spinal cord injury is that? It's called impossible. Does that make sense? You just think about it. You can't have an injury up here, and this is still working. You still blocked all the highways going up. So you can't do that. Okay? And that's where Christopher Reeve came in. That's why I'm wearing this tie. See, I always try to come up with a theme. Okay? There was a catch there. But yeah, so this is what happened with Christopher Reeve after he had his horse riding incident, and he was, I guess the horse bucked and he fell and he landed on his head, and he kind of literally snapped his, or broke, was it C? He had spinal cord at level C2, much high up here, and that left him as a quadriplegic. Okay? So you all heard about that. And about a year later, his wife died too. They breast cancer or lung cancer, yeah. So it was a very tragic thing, but he was a very, he was a humanitarian kind of thing. And it's kind of ironic how much he was a humanitarian, and yet he played Superman, which was, you know, people that looked up to. So he kind of fit the play. So, okay, a stroke. Well, this is not a stroke. A transient ischemic attack, a TIA. Laymen call it a mini stroke. You wouldn't call that in the medical realm, call it a mini stroke. You would call it a TIA. All it means is that it's you get a temporary lack of oxygen to a certain part of your brain, but it has to resolve within 24 hours for it to be considered a TIA. It's transient. It's just going to be a temporary thing. If it lasts longer than 24 hours, that wasn't a TIA then. And you got a full-blown stroke. Okay? Most of the cases will resolve in the first hour. Is it anything to worry about? Well, you have multiple of these TIAs. It's little red flags. There's something going on, and this can lead to a major stroke. Okay? This guy here, Frank Nunez, he's from what? Is it Malcolm in the Middle or The Middle? But wasn't there a TV show called The Middle? And that's not the same thing. Oh, that's the one. Okay, so they're not they're not brothers or anything. So I don't know. All right. So anyway, he suffered 2 TIAs in 26 and 27. So you know his doctors are looking at him. Okay, at 26 and 27 years old. Okay. Yep.
What causes that?
We don't know. It's usually some kind of vasal spasm that can cause that. It could be that there is some blockage there. For some reason, the blockage was too great, but yet it broke through. It could be a lot of reasons. Usually vasospasm, though. Okay? So, now, this is the stroke that everyone hears. Okay, this is the 5th cause of death in America. I would know everything about this going into the nursing program or radiology or occupational therapy. You should know the top 10 killers in America because that's what's going to be tested on all your boards. If this is the 10 top killers in America, they're going to be making sure that, well, this is what's coming in the doctor's office, this is what's coming into the hospitals, this is going into the clinics. So you've got to be well exposed to that, all the different parts, okay, of these 10 killers. So this is what's referred to as a stroke. It's called a cerebral vascular accident, or a CVA. You'll hear that more common than a stroke, okay? What happens here is that you will have ischemia, which is a lack of a blockage or a lack of oxygen going to a certain part of your brain, okay? If it occurs for a longer amount of time, like 4 minutes, then you're going to have a lot of oxygen not going to that part of the brain, and that brain is going to die, okay? And then we call that infarction, okay? You could have myocardial infarction, that's a heart attack. You could have cerebral infarction, that's called a stroke, okay? So that's where that comes into. About 500,000 people have strokes per year. This is what we call a third, a third, a third. People who have strokes, a third of them will have complete resolution. They won't have any problems afterwards. A third of them will die within 2 weeks. And a third of them will actually have they'll survive, but they're going to have some kind of compromise to their body, or they're talking or something like that. So we say it's a third, a third, a third. Okay? Hemiparesis is a weakness on one side. This is where we're talking about left versus right. Hemiparesis. Hemiplegia is paralysis to one side. You just can't move it. Okay? Just, again, keep note. I put this in a box like this because I don't want you to get confused with paraplegia and hemiplegia. Okay? Both of them are half the body, but which half? And yes, to add even confusion, you could even have something called a hemiparaplegia, meaning that the lower half doesn't work on one side. So one leg doesn't work. Okay? So when you if you're going to occupational therapy and you've got to see someone who's a hemiplegic, at least you have an idea of what you're going to walk into and have an idea of what kind of exercises and what kind of ways you're going to have them put on pants, put on shoes, and whatnot. Okay? So it's just showing you hemi on left versus right. And these are people that had strokes. Who's that? It says it right there, I know. That's Luther Vandross, right? Who's this? This is Dick Clark. This is, for all you young people, Ryan Seacrest of today was Dick Clark of yesterday. In fact, Ryan Seacrest is taking over his job, basically. The American Idol was his American Bandstand. Okay? Even the ball coming down in New York City, he's the one that started. It's called Dick Clark's Rockin' Eve. Yep. So that's where Dick Clark is. Well, it's kind of an interesting thing how Ryan Seacrest is doing everything that he was doing. So, and who's this guy? I'll give you a hint. He's not a crook. Yeah, that's Nixon. All right. He was one of our presidents back in the early. He got us out of the Vietnam War, so he's doing that stuff. And who's this guy? You don't have any great expectations with this course, do you? Who's that? Who wrote Great Expectations? Charles Dickens, right? Charles Dickens, right? He also did Christmas Carol, not story, right? And, Christmas Carol. All right, so these are people that had strokes, CVAs. Okay, so if you think about it, and you should understand this now, a CVA on one side of the brain will cause motor loss on the opposite side of the brain. Why? You know it. I mean, it's pretty simple. You have the decussation, right? You got the crossing over going on one side. That's what it is. Tracks cross over. Okay? So if you think about it a little bit more, if we cut just one side of the spinal cord at a particular level, as you can see over here, how will the patient present? All right. what will be affected on the same side, what will be affected on the opposite side. That's the things that should go into your head, how to go about doing this. Okay? Instead of just memorizing this part, apply it so that you'll remember it later. Okay? Now, I won't ask you about this per se, because it could get really busy. But a Brown-Sequard lesion is just that, what we've been talking about, where half of the spinal cord is severed. There's some kind of lesion on one side. Okay? It happens. All right? It's a hemisection or cutting on one side. And it could be due to a tumor invading that one side. It could be tuberculosis invading one side, ischemia, multiple sclerosis, a motor vehicle accident. Things can happen. Okay? So results in the lesion, results in a level below the lesion, you'll have ipsilateral effects, hemiplegia that happens over here, and contralateral effects. Again, I'm not going to ask you all about this. It's too heavy for you to deal with. But a lot of students, not a lot, but a handful of students have an interest in there. They want to go into nervous system. They want to learn a little bit about it. And you could go ahead and do this for yourself. But basically, if the lesion happens here, what happens to the corticospinals? What happens to the dorsal columns? What happens to the spinal thalamus? Okay? And I kind of did it in color-coded where black, beige, or peach, and green, and they kind of show you what's going on over here. Okay? It's busy, but it's very interesting, though, how this whole thing happens. Okay? What about ALS? You've all talked about ALS, taking that ice water and pouring it over you, right? All right? Those challenges that was happening a year or two ago, right? So this is what it stands for. Amyotrophic lateral sclerosis. I bet you didn't know about that, but you know it as ALS, right? This is also known as Lou Gehrig's disease because Lou Gehrig, he was, what was he? Well, Lou Gehrig was what? Baseball player back in the 1940s or so. And he was, I guess Lou Gehrig's disease existed before him, but I guess he's the first celebrity and they named it after him. You'll find out that a lot of diseases are either named after people that died from it or people that discovered it. I personally would rather be the one who discovered it. Okay? So what happens here, we don't know the reason for it. It's an idiopathic cause, meaning unknown cause. You get chronic progressive destruction of the motor neurons. Which ones? Both. The upper motor neuron and the lower motor neuron. All right? And what happens here is that the sensation's intact because we're just dealing with motor. So they can't move their bodies. Who's this guy over here? The Einstein of today, right? What is it? Hawking, right? Stephen Hawking, right? And this is Lou Gehrig in his better days. So what happens is death usually happens over here due to respiratory rest, when the diaphragm is just not working anymore. So they're going to have paralysis both spastic, because upper motor neuron, and flaccid, which is going to be lower motor neuron. Okay? Now, here's where I'm going to just explain to you how everybody in this room, if you get in contact with someone who has Lou Gehrig's disease, this is where you have to understand the concept. You understand the disease and how it affects it. You're going to see someone one of these days with Lou Gehrig's disease. And I'm hoping it's just a patient, not someone like a family member. You're going to have someone who has Lou Gehrig's disease, and you're going to see he's not going to be able to move his body. Most people will say, well, I'm not going to touch him because he won't feel it anyway. Wrong. This is where the art of science comes in, the bedside manners. If you understand how this works, then hold his hand. He's gonna feel you. He wants that. He's all alone in this you know, in his world over here. He can't move, but he could surely feel your warmth there. Squeeze his hand. He isn't going to be able to squeeze back. Understand that. But he needs that over there. She needs that. This is where it's not going to be really taught. Or if it is going to be taught, you won't understand it. I'm making sure you understand it. It's not the sensory that's affected. It's motor. Does that make sense? Okay? So that's what goes on here. That's ALS. Another one that's similar to this that I know you heard about is polio. Okay? Poliomyelitis. Who's this guy?
Roosevelt.
Yeah, which one? No, not Theodore, the other one. Franklin Delano Roosevelt, FDR, okay? He's the one why we have Social Security. He's not the reason why Social Security is not going to be there in a few years. That's a different story, okay? That's a different president. But anyway, what he had was polio. We don't see polio as often because we have vaccines. But he had polio. He had polio as a child. He became, which is a pretty impressive thing, he became president with polio, okay? What this is, it's due to the polio virus, and it's spread through fecal contamination of water. What happens here, it destroys the motor neurons only in the anterior horn. So therefore, it's the lower motor neurons that get affected. That's where it is. It's the cell bodies that get destroyed in the anterior horn. Again, will they be able to feel? Yes. It's only affecting the anterior horn. So likewise, as I just gave my little spiel about people with Lou Gehrig's disease, people with polio, hold it. We still see people with polio when they were children, before the vaccinations came out. So it's elderly people that have this, or people that came from other countries, third world countries that can't afford the vaccines. So we still see it. We just don't see it much in America, except for the elderly who had it when they were kids. Does that make sense? So you're still going to be seeing it. You're just not going to see epidemic of it. Does that make sense? Okay? So again, hold their hand. They're going to feel that. Okay? It's like they could feel the fly on them, but they can't swat it away. They can't move. Okay? But they're going to have paralysis, but only flaccid because it's lower motor neurons, not the spastic. But if you look at their legs, they just you lift them up and they just go right back down. Okay? And they usually die because of respiratory arrest too. Once the diaphragm gets affected, they can't breathe properly. Okay? So that's polio.